hundreds of unemployed healthcare workers were expected to converge on the corner of Madiba and Kgosi Mampuru streets in Pretoria Central from 8 a.m. this morning before marching to the union buildings. Now, the healthcare workers are concerned about the lack of job opportunities in the country. They say they have been trained at a high cost to the country and yet they remain jobless. Kelebogile Botlholo is covering the story for us. Kelebogile, thank you so much for your time. So we've seen a number of marches, particularly by doctors in this country who say that, they need employment, particularly because they are being trained by government. Who is marching in this particular march? And also just talk to us about what is happening there.
Resources such as medicine and equipment to rural areas.
Hi, Unati. So yes, the South African Medical Association's trade union organized this march in support of the health professionals who are currently not working. Some of them are not working, and yet they are qualified doctors and qualified nurses, qualified medical professionals, basically, who are now have a lot of grievances with the Department of Health, saying that some of them have been trained by the government to be qualified medical professionals, but they still don't have jobs. And here to tell us more and in support of the medical professionals is Kelebogile from Gauteng Arise Mzansi, and he says he's here to tell us more about why they're here to support the medical professionals.
Hi, good afternoon. How are you?
I'm good. How are you? So Tebogo, please tell us why is Rise Mzansi here, and why you guys feel the need to support medical professionals and the South African Medical Association's trade union?
Well, we've got a serious problem with jobs in the country. The reality is there's far too many people out of work, and that is no different for doctors. People think that healthcare professionals are superhumans. They're not. They're human beings like us. They need to be looked after. If we have more than 800 doctors who are qualified, who are able to work and not in our hospitals, it means longer waiting time, longer lines, which means that our people will die in those lines. We cannot have this as a people. This government continues to fail us, and we must stand in solidarity with healthcare professionals to say we will fight with you. You fought for us during COVID. You continue to fight with us for us when we are unhealthy, and so we are here as Rise Mzansi, shoulder to shoulder, to carry you to your victory.
Okay, so thank you so much. Please tell us, what exactly is it that the medical professionals are not happy about?
They're not happy, first thing, about the fact that they don't have jobs. Many of them have qualified, they went to schools, their parents and grandparents fought hard for them to get this education. And coming out of that school, they now sit at home, not being able to service the communities. Many of them are asking for an opportunity to serve. Why would we not give them an opportunity to do so? So it is about jobs, but it's also about the quality of the healthcare facilities they work in. They work long hours, they work in hospitals without equipment. Even neonatal service units don't have the basic resources. And whilst that is happening, we've got the Gauteng Premier Panyaza Lesufi promising that he's going to buy 14 hospitals and convert them into public hospitals. This government must get the basics right. Don't talk about high-speed trains and 14 hospitals. Fix Charlotte Maxeke. Fix Baragwana Hospital. Make sure that the things that we have can work to serve the people, but get doctors into work so that they can serve the people.
Thank you so much, Tebo.
Thank you.
Okay, yes, Unati, that was Kelebogile from Rise Mzansi saying that they are here in support of the medical professionals, and we will try to speak maybe a bit later to one of the medical professionals or somebody representing the medical professionals and try to find out what is it maybe that they would like to get from the government and why they actually decided to come to the union buildings instead of going to the Minister of Health himself.
Before I let you go, I'm assuming that they will be handing some form of memorandum to an official. Who are they likely to meet there, and who is going to be receiving that memorandum?
So right now the professionals are still busy having a talk among themselves, and we're just here to find out who they're going to be talking with and who's here to meet them.
All right, Kelebogile, thank you so much for that.